Azelaic acid for hidradenitis suppurativa, hidden skin benefits you need to know. Welcome to our channel, your go-to destination for all things skin health. And today we're diving into an intriguing topic that is near and dear to many of you. Can azelaic acid be a game changer for those dealing with hidradenitis suppurativa? But before we delve into that, let's take a moment to introduce ourselves. We are a team of board-certified dermatologists dedicated to making skincare understandable and effective for everyone. So if you're new here, consider subscribing so you never miss any of our enlightening videos. Now back to the exciting topic at hand. As a multi-purpose skincare ingredient, azelaic acid has garnered significant attention for its effectiveness in treating various skin conditions from acne and rosacea to hyperpigmentation. But did you know that there is a growing body of evidence suggesting its potential benefits for hidradenitis suppurativa? Well, if not, you're in for a treat. In this video, we'll explore the latest research, uncover the mechanisms behind its action and share some valuable insights on how to incorporate azelaic acid into your daily routine for maximum benefit. Let's start with the basics. What exactly is azelaic acid? Azelaic acid is a naturally occurring compound found in various sources including grains such as barley, wheat and rye. In skincare, it's derived from these grains through a series of chemical processes. Renowned for its mild yet effective action, azelaic acid has gained recognition among dermatologists for its ability to combat acne, reduce rosacea symptoms and fade hyperpigmentation. Its unique molecular structure allows it to penetrate the skin effortlessly and rapidly, ensuring optimal efficacy. You may be wondering, how does azelaic acid exert its magic on acne, rosacea and hyperpigmentation? Its powerful antibacterial properties make it an excellent choice for treating acne by effectively eliminating excess bacteria within clogged pores. This mechanism prevents the formation of pimples and reduces inflammation, leading to clearer skin. Furthermore, azelaic acid's anti-inflammatory properties shine in treating rosacea by soothing irritated skin and diminishing the appearance of redness and bumps associated with the condition. When it comes to hyperpigmentation, azelaic acid acts as a tyrosinase inhibitor, reducing the production of melanin, the pigment responsible for dark spots and uneven skin tone. By inhibiting melanin synthesis, azelaic acid promotes a more uniform and brighter complexion. But the exciting news is that recent studies have revealed potential benefits of azelaic acid for hidradenitis suppurativa. Hidradenitis suppurativa, often referred to as HS, is a chronic skin condition that causes painful, inflamed lumps to form under the skin. These lesions typically appear in areas of friction such as the armpits, groin or buttocks, leading to discomfort and distress. HS can significantly impact a person's quality of life. The condition has a strong genetic component and is characterized by inflammation of hair follicles and oil glands. The hallmark of HS is the development of deep, painful nodules that can become pus-filled and may even rupture, leaving behind scars and disfigurement. Managing HS remains a challenge and treatment options are often limited. So how does azelaic acid come into play? Research suggests that azelaic acid's anti-inflammatory and antibacterial properties may offer relief for individuals with HS. By reducing inflammation and killing harmful bacteria, azelaic acid can help alleviate the pain and discomfort associated with HS flare-ups. Some studies have shown positive results when azelaic acid is used topically on HS lesions. It's important to note that while promising, more research is needed to fully understand the efficacy of azelaic acid in treating HS. However, anecdotal evidence and personal experiences have led many individuals with HS to include azelaic acid in their skincare routines as a potential natural remedy. That's right, we're talking about the personal stories and experiences that have inspired a community. Many individuals living with HS have embraced azelaic acid as part of their skincare regimen. They've shared their experiences and insights, creating a sense of community and hope. Now let's talk about how you can incorporate azelaic acid into your routine. If you're eager to try azelaic acid, here are some essential tips to ensure safe and effective use. Always consult with a healthcare professional or dermatologist before starting any new skincare regimen, especially if you have sensitive skin or pre-existing skin conditions. They can guide you on the appropriate usage and help you determine the right concentration for your needs. Typically, azelaic acid is available in concentrations ranging from 7% to 20%. For those new to azelaic acid, it's recommended to start with a lower concentration, such as 10%, and gradually increase as your skin becomes accustomed to it. One way to begin is by incorporating azelaic acid into your existing skincare routine. Cleanse your face thoroughly, then apply a pea-sized amount of azelaic acid cream or gel to your affected areas. Gently massage it into your skin until it's fully absorbed. Consistency is key when using azelaic acid, so it's important to apply it regularly for optimal results. Most dermatologists recommend applying it once daily, preferably in the evening before bedtime. However, based on your skin's response and the severity of your skin concern, they may advise more frequent applications. While azelaic acid is generally well tolerated, it's crucial to take precautions to minimize potential side effects. Always do a patch test on a small area of your skin before applying it to your entire face or the affected area. This will help you determine if you have any allergies or sensitivities to azelaic acid. Additionally, avoid contact with your eyes and mucous membranes. If it does get into your eyes, rinse thoroughly with water. If irritation, redness, or other adverse reactions occur, discontinue use and consult with your dermatologist. Remember, azelaic acid is a powerful ingredient, but it's not a one-size-fits-all solution. Some individuals may experience dryness or a burning sensation, especially if they have very sensitive skin. In such cases, it is advisable to consult with a dermatologist who may recommend using a moisturizer or suggest alternative skincare products. And here's a bonus tip. To enhance the effectiveness of azelaic acid, consider pairing it with other skincare products that complement its benefits. A gentle cleanser, a lightweight moisturizer, and a broad-spectrum sunscreen are essential components of a minimalist skincare routine. The combination of azelaic acid with these products can help maintain your skin's overall health and support its natural barrier function. Don't forget to protect your skin from the sun's harmful rays. Use a broad-spectrum sunscreen with an SPF of 30 or higher every day, even on cloudy days. Sunscreen helps prevent sunburn and further skin damage, allowing your azelaic acid to work more effectively. As we wrap up this informative session on azelaic acid, we want to emphasize that while it shows promise for individuals with HS, it's not a standalone solution. Managing HS requires a comprehensive approach. Consult with a dermatologist or healthcare professional to develop a personalized treatment plan that may include a combination of topical applications, oral medications, and lifestyle modifications. Azelaic acid might not be the silver bullet for HS, but it could be a valuable addition to your toolkit. Remember, knowledge is power. By understanding your skin conditions and the ingredients you use, you can make informed choices that empower you on your journey to healthy, radiant skin. If you found this information helpful, give us a thumbs up and share it with someone who might benefit from it. Your support means the world to us. Thanks for joining us on this episode. Stay tuned for more informative content on skin health and skincare. Until next time, stay healthy and take care of your skin.